Come with me into a day of the life of a first-year PA student. The first task on the docket is waking up, which actually is the hardest one for me, but this little guy makes it not so bad. It's time for our family to eat, and on the menu for me, we've got some yogurt with chia seeds and granola. Today, we do have a big pathophys exam, so I'm doing some last-minute studying just to make sure I'm prepared. Shout out to Sketchy for these super adorable stickers. Sketchy has material for PA students, both in their didactic and clinical year. Of course, there are the classic sketches which show images and associate phrases with icons, but there's also this super cool thing called the Q Bank, where you can put all the questions according to which topics you want in one test. And here, I think it's so cute that the acetyl cooler reminds you of acetylcholine. Now I'm testing myself on that lesson, and this totally was my first time taking it. Anyway, gotta get to school. Let's get changed and head out the door. I ended up doing well on that exam, so my friend and I are grabbing coffee to celebrate. I forgot to record that we had classes later that day, so here's a quick clip of me presenting on a project. Earlier, you saw me use Sketchy to do some last-minute review for that exam, but to take things to the next step, there's Sketchy Cases. Sketchy Cases simulates real patient encounters with real conditions, and I get to talk to a preceptor. This person came in with some wrist pain, so I'm thinking it's either a fracture, sprain, or something underlying that's inflammatory. I ask him questions like, how did this happen? Does anything make it better or worse? At the end, Sketchy Cases summarizes our history and physical exam findings. I'm thinking it's a fracture, so I decided to get some imaging, and here we are. It's looking like I was right about that scaphoid fracture because Sketchy Cases starts to ask me some questions, and I get them right. Now that we've got this right answer, it's time for my preceptor and I to discuss treatment and management. Alright, after logging in about 3 hours of studying, it's time to wrap up my night and get ready for the next day. I'm off to pack my lunch, brush my teeth, pick my clothes, and head to bed. Thank you so much for joining us. Good night.